soft lump under the skin. Is it harmless or harmful? Let's talk about lipoma today. Hey all, I'm Dr. Pooja from Ayur Varta, and we have with us a wonderful surgeon, Dr. Sandeep Mishra sir from Aviral Hospital. So we welcome you.
Thank you, ma'am.
Coming straight to question, sir. What is a lipoma? How is it different from other lumps in the body?
Ma'am, lipoma is basically tumor of adult fat cells,
Okay, sir.
and it is also known as universal tumor. And it is found in all over the body. It may be found anywhere where there is fat cells. That's why it is called universal fat tumor.
So why is it formed? Is it genetic, lifestyle disorder, or kind of bad luck of patients?
Ma'am, it is genetic. There are genetic predispositions found in this, and along with that, dietary habits are also responsible, as it is related to the rich fat diet, more amount of cholesterol,
Okay,
and
sir.
lipid profile. If it is deranged, there are chances of forming lipoma.
Okay, sir. And who gets lipoma often? Which age group is more prone to lipoma?
As I have told, ma'am, lipoma is the disease of adult fat cells, so it is more found in the adult generation.
Okay, so more found in adults, right?
Yes.
And how can adults make out if it is a lipoma or some different lump?
Lipoma has, ma'am, 3 or 4 definitive characteristics. Like it is mostly mobile.
Okay, sir.
It is not fixed to the underlying structures. And when we move the lipoma, then there is formation of dimpling under the skin.
Okay, sir.
And it is a semi-fluctuant swelling.
Okay, sir.
It is semi-fluctuant. When we press it, it gives the swelling of feel of cystic swelling.
Cystic swelling. Okay, sir. That means it's movable.
Yes.
And that is how a patient can make out if it is a lipoma or some other lump in the body.
Yes.
Okay, sir. Sir, are lipomas always painless or they cause pain at one point of time?
Ma'am, lipoma are initially painless. There is pain only if there is involvement of some nerves undergoing there.
Okay,
So
sir.
if there is involvement of nerve, then it may be painful. Otherwise, it is painless.
Okay, sir. So mostly it is painless. Only when nerves are involved, it will be painful.
Yes.
Okay, sir. Can lipoma grow in size or number?
Ma'am, lipoma is basically of 3 types
Okay, sir.
on their clinical representation. First one is single capsulated lipoma. So it is single in number, and it is maybe of large size also.
Okay, sir.
And then second one is multiple lipomatosis, in which there are multiple lipomas all over the body. This may be also capsulated. And third one is diffuse lipoma or uncapsulated lipoma. In this there is growth of the fat cells, but it is not encapsulated, it is not demarcated. So it is diffuse growth of the fat cells.
Okay,
So these 3 types are there. So some patients have single lipoma, some have multiple, and some have diffuse.
Okay, sir. What triggers their growth?
Growth is, ma'am, it is slow growing, and it is slow growing process of the lipoma growth.
Okay, sir. So nothing specific, no specific triggers are there for the growth of lipoma.
We can say that if you eat rich amount of fatty diet, then it may promote lipoma growth.
Okay, so it may trigger lipoma growth.
Yes.
Okay, sir. So how is it diagnosed? Like clinically or with some MRI or USG is needed?
And there are clinical pathognomic signs like dimpling of the skin and pseudo fluctuation, and it feels like a pseudocystic swelling. But if you talk about investigations, we go for USG of the swelling.
Okay, sir.
Ultrasonography of the swelling. So it is a mostly subcutaneous growth. And apart from that, we go for invasive test, FNAC, fine needle aspiration cytology test, in which we take the cells from the lipoma and get it investigated. Then it is clear that it is lipoma.
Okay, so basically we do it clinically, USG and FNAC. These are the 3 options.
Yes.
Usually.
Yes.
Okay, sir. So what are the red flags? When can we consider lipoma as a red flag in any person?
If the lipoma is growing very fast,
Okay, sir.
and if there is pain, sudden pain is started, and if the skin over the lipoma is red colored, and if there are pus formation, that means the swelling is getting infected, and there is inflammation and tenderness. So if these symptoms are arising, one should get aware and go to the surgeon as soon as possible.
Okay, so mainly when it is growing at a faster rate, one should consider it as a red flag and get diagnosed as soon as possible.
Yes, ma'am. Because sometimes lipoma can also convert into liposarcoma and other CS.
Okay, sir.
So that's why one should get aware and get it checked.
So what are the treatment options available right now?
Treatment options, ma'am, we go for surgery. If there are multiple lipomas, we remove the bigger lipomas by incision. And if they are small lipomas, we give a smaller nick and we pop out the lipoma from that incision. So this is minimal invasive surgery, a kind of. And if they are big lipomas, then we have to do a proper dissection of the lipoma and remove the surrounding and then get excise it.
Okay, sir.
So these are the two options according to the size of the lipoma and location of the lipoma.
Okay, sir. So we can't ignore surgery?
No, ma'am. If we can wait and watch, one thing we can do that if the lipoma is not growing, it is not causing any problem, we can get it tested and we can wait and watch. If it is cosmetically getting a problem, aesthetic problem, or if it is painful, or if it is growing very fast, then we have to go for surgery.
Okay,
and we have to get it removed and get it checked histopathologically that it is lipoma or any other disease may also exist in that.
So surgery is a better option?
Yes, surgery.
Okay, sir. So can lipomas recur after removal?
Yes, ma'am. As I have told that there is genetic predisposition and it is also related to the dietary habits. So there is tendency in the body to form the lipoma.
Okay, sir.
So we can remove the lipomas, but there are chances to reoccur and reform many other lipomas.
So by any chance we have any preventive measures?
As I have told, ma'am, we cannot change the genetic constitution, but we can control our diet. We can take fibrous fruits, fibrous vegetables, and we can reduce the excess fat content in our diet and take a balanced diet, do exercises, and keep ourselves fit, avoid sedentary lifestyle. By following all these guidelines, we can prevent the lipomas.
Okay, sir. So thank you so much, sir, for providing all the information on such a wonderful topic, which is lipoma. Most lumps, they create anxiety before they turn into problem. So it's better to be aware of it and try to get it diagnosed as soon as possible. आज की वार्ता बस यहीं तक. फिर मुलाकात होगी नेक्स्ट एपिसोड में. टिल देन स्वस्थ रहें, मस्त रहें, व्यस्त रहें. धन्यवाद.